Hi, my name is Michelle Baldonado. I work for a major healthcare corporation in Tucson, Arizona, and the CEO of the company has asked me to consider a few outreach programs that will help benefit our community. I have actually thought of a couple ideas. First and foremost, since we live the town's not as small as it used to be, but it is still considered a small town compared to Phoenix, Arizona. But since we live in Tucson, Arizona, we are surrounded by a lot of mining towns that are rural areas. We are also surrounded by a lot of retirees who have adult children grow up and move on, so they don't really have a lot of interaction outside of their home based on the fact that they're reliant on, transportation and, it's just easier to stay home. So, what I'd like to have my CEO consider is one, reaching out to these rural towns. Kearney, Arizona, for instance, a very small retired mining town, and there are a lot of miners who don't have access to good health care. In fact, most of these rural towns have to travel outside of their communities for any type of health care. Unfortunately, because there is low education and just not a lot of option for travel, there's not a lot of transportation. It's not like they can take a bus. I think that it would be a great idea to create a traveling team and create a satellite clinic where we can reach out to these communities once a month, travel out to, give health care. And, I think that it's important that these smaller communities understand that, these bigger corporations aren't just big corporations that are out for making a buck or two. I think we need to personalize it and really travel out and go above and beyond and make a difference in these small towns that don't have a lot of access to good health care. My second choice for outreach is to reach out to the elderly that are in a community, again, retired, with not a lot of access to transportation and not a lot of options for people to transport them to these healthcare communities. So I think going out and locating a centralized satellite clinic, potentially in an area where there are a lot of retirees that can literally walk to the clinic to get service, is another great opportunity. The elderly seem to be forgotten and left behind, and I think it's very important that we try to, establish some type of outreach for them as well. So those are my two choices that I would choose for outreach programs. Explain why the programs would appeal to and benefit the community. Because most people look at big corporations as, just about making the money. And I think our values stand for much more than just making the money. We aim to really improve. We're committed to always improving our process. We're patient obsessed. And we really, really want to be what everybody's ideal healthcare community is without the label of being a big corporation. So I think being, willing to go out to these smaller communities and give these less fortunate people access to good health care and going above and beyond is a really good way to appeal and benefit not only these smaller rural towns, but, Tucson in general. So, there's two ways that the company will benefit from these outreach programs. Again, because we are a big corporation and we're willing to go out to these smaller communities, that's kind of a way of marketing. We're marketing the providers that are above and beyond good. They are just, not only do they have the experience and willingness to drive out to these smaller communities, they're also really good at what they do. So I think we'll make a difference in people's health as far as these minors that have not really had access to good health care, that might be diabetic or have heart disease, to make a difference in somebody's life by just coming out and giving them what they really need in their health and medication is very important to a lot of people. I know family members, just to see somebody that they love be able to have a better life based on access to health care is a really good way for the company to benefit as far as marketing goes. Community relations, that's huge. Not very many physicians are willing to travel out to these rural areas and make a difference in someone's lives. That's huge. We can build this community of trust and assurance with these patients, and really, I think that says enough in itself. So how can we measure whether the program was successful? Obviously, with any new company, we're going to start out with very limited, probably not even a full day of seeing patients in the very beginning. But as word gets out that we're coming in once a month and we've made a difference for a patient that's hypertensive, that has been prescribed the correct medication, who can now actually go out and interact with their family, take a walk in the park, word like that's going to spread around in the community, and the community is going to look forward to our traveling staff coming out to visit them and make a difference in their life. So that's how we're going to measure our success. We'll start out small, but as word gets out that we're this great, what I would probably refer to as dream team, we're going to start to build a practice in these rural areas, and that's going to measure the success in itself. Now, we could certainly, go on the website, but I think based on the community outreach program that I have chosen, we're probably going to be dealing with a lot of people that don't have a lot of knowledge on how to navigate through the web, or even go on to a web address to even acknowledge that they're excited and pleased with the fact that we're willing to travel 100 miles once a month to take care of the community. So I think the best way to measure our success would to be just to see how our practice grows in these rural areas. And the same goes for our elderly who, have the opportunity to receive good health care. I think, again, we'll start out small, and as word gets out, our practice will grow. So people will look forward to seeing us. Thank you. You have yourself a wonderful day, and I hope that this has been a great informational video.